You're a high achiever. You're successful. You've spent a lifetime building a business or a career, or maybe you're the mom manager and you get everything done. You get everybody where they're supposed to go. But lately you haven't felt like yourself. You're gaining weight. You're not sleeping well. You have no interest in intimacy with your partner. Your relationships are struggling. But you've been to the doctor and he really hasn't given you any answers and you're frustrated. You know there has to be a solution somewhere. And you're right. Hi, I'm Cindy. I'm a family nurse practitioner with over 30 years of clinical experience, and I help people like you every day. See, when I was in primary care, I saw patients in their 40s and 50s with those same frustrations, struggling with weight gain, brain fog, no energy, needing a nap in the afternoon, while at the same time, I was struggling with those things myself. And that's when I left primary care. And I spent time and money advancing my education in functional medicine and hormones. And I opened my clinic, Optimal Body and Health, clinic in Mansfield and Mount Vernon. And I help people who want to feel like themselves again. They're open to holistic approach to medicine. They're healthy conscious. They want to improve their diet and they just want to feel like themselves again. Maybe you're like Sarah, who is in her 40s and she had a career. She was taking care of 5 kids. She was exhausted. She had no interest in sex with her husband. She went to the doctor and he said, well, you're tired because you have 5 kids. There's nothing wrong with you. Your labs all look normal. Well, when Sarah came to me, she was very hesitant that I could help her. But we sat together, we did the labs, we talked about all of her treatment goals, put her on plan, and within 5 minutes, she was losing weight. She was getting off work. She didn't need a nap anymore. And she was hustling those kids and she was feeling like herself again. And she called me and she said, I really didn't know I could feel like this again and feel so good. Or maybe you're like Pam. Pam called me. She was a year postmenopausal, so periods were gone, but she was really gaining significant amounts of weight. And Pam had a very successful career, was high pressured, and she had spent years getting to the top in her field. And when she called me, she was struggling at work. She wasn't the same person anymore. She was coming home and going straight to bed. And she was very frustrated too. And the doctor had told her the same thing. You're in menopause. You're just going to have to adjust your life. You can't do the same things anymore. So when Pam called me, she really wanted answers. And we did the labs. We did the treatment plan. And you wouldn't believe how much better Pam is. And she's even tackling more things at work. But maybe you're like Jim. Jim had this whole successful business that he had built with his dad. Very, very successful, working out all the time. But in the last year, he was gaining weight. He was stressed. He was puffy. He was having some erectile dysfunction, decreased libido. And when Jim came to me, he was really open to a treatment plan. We got him on testosterone, a nutrition plan. We looked at all his health goals, and within 6 months, he looked like a completely different person. He put in the work, but he was open to listening to what the goals were and what the treatment plan was. My steps to your treatment plan include looking at all the hormones. So we're going to look at stress hormones like cortisol, which really increases your desire to eat sweets and salts and fats. It interrupts your sleep. It causes belly fat. And then we're going to look at the sex hormones, estrogen, testosterone, and progesterone. And when we get all those working together, you're going to sleep well. You're going to have lots of energy. Your brain fog is going to go away. You're going to have that really significant increase, and that desire is going to come back to be intimate with your partner again. And then we're going to look at lifestyle habits. We're going to look at sleeping and stress management, which is so important, and really getting your nutrition back on track. So I have 3 common questions that patients really always come to me and ask. And one of those is, what's the cost and why don't you use insurance? Well, really that goes together, and thinking about cost is really, really important, and I understand that, but insurance is very limiting. They're not going to pay for any of this treatment. They're not going to pay for the appropriate testing that we really need to dig down deep and figure out what's going on. And as far as cost goes, I really look at this as a health insurance plan, a retirement plan for your future self and your future health. We work with payments, we work with people and their budgets to get a payment that they can work with. You might be thinking, well, is it going to work for me? Well, you're not broken. You just haven't had the right testing. We just need to come up with the right testing, the right data, and get you on a treatment plan. And then you might think, well, do you work with everyone? Well, I don't work with everyone, because if you're not willing to make changes in your lifestyle, or if you just want me to write a prescription for a medication to get you better, that's really not my approach, because that approach really doesn't work long term. So if you're open to lifestyle changes, then you and I can probably work really well together. So what's the next step? Well, the next step in getting you feeling better is really to hop on a discovery call. So you can go to my website at optimalbodyandhealth.com and sign up for a free 15-minute discovery call. You can sign up on all my socials, Facebook, Twitter, TikTok. They all have links to my website. And the discovery call really just involves us having a conversation. You're going to call me and talk to me about how you feel and what you're struggling with, and I'm going to listen, and I'm going to tell you my treatment plan, how that works, how that approach is, and we're truly just going to decide if we can work together. You don't have to settle. You can feel like yourself again. Let's do this together.